Good afternoon. I'm Dr. Bonnie Henry, Provincial Health Officer for British Columbia, and this is our COVID-19 update for Monday, October 26th. I'd like to start by acknowledging that we are on the traditional territories of the Lekwungen-speaking people, the Esquimalt and the Songhees First Nations, and we are always grateful to be here on these beautiful lands. Today I'll be providing our case updates for 3 periods. Between Friday and Saturday, we had 317 new cases identified in British Columbia. From Saturday to Sunday, an additional 293 new cases. And from Sunday to today, another 207 new people diagnosed with COVID-19. In total, for this past weekend, we have had 817 new cases, including 11 epidemiologically linked cases, bringing our total number of cases of COVID-19 in British Columbia to 13,371. That includes 4,428 people in the Vancouver Coastal Health Region. 38 of those people are in hospital. 7,529 people in the Fraser Health Region, again 38 of whom are in hospital. 250 people in Vancouver Island, 639 people in the Interior Health Region, 383 people in Northern Health Region, and 88 people who normally reside outside of Canada. We are currently have 2,325 active cases across British Columbia, of whom 77 are in hospital, 26 of whom are in critical care or ICU. Sadly, this past weekend, we've had an additional 3 people who have died from COVID-19 in British Columbia. All 3 of them were in long-term care homes in Vancouver Coastal Health. And our condolences go out to the families and to the care providers in the communities who mourn their loss. We have 5,077 people now under active public health monitoring, and 10,734 people have recovered from COVID-19. We have 4 new healthcare outbreaks, all in long-term care homes: Queen's Park Centre, Almenida Seniors Community, and Agassiz Seniors Community in Fraser Health, and the Banfield Pavilion 4 West in Vancouver Coastal. In addition, 4 long-term care outbreaks have been declared over. 3 care outbreaks have been declared over, including Chartwell House and Thornbridge Gardens in Fraser Health, and the Point Grey Hospital outbreak in Vancouver Coastal Health. We now have 21 active outbreaks in the healthcare system, 19 in long-term care and assisted living, and 2 in acute care, involving 967 people, 549 residents, and 418 staff. Sorry, I don't have my notes together quite right. In addition, there's been 1 new community outbreak at the Surrey Pretrial Services Centre, and the outbreak at the FedEx office in Kelowna has been declared over. As a result of exposures affecting larger numbers of staff and teachers, 2 schools have been closed for the duration of the incubation period, 1 in the Fraser Health Region and 1 where the outbreak was declared in Interior Health. We knew, of course, this would be a possibility, especially in some of the smaller schools where the potential of exposure impacts a larger proportion of the school population. And while the numbers of people with COVID are small, the requirement for those in contact to be in self-isolation has meant that the school can no longer safely operate. So the schools are working with the families to ensure that educational opportunities continue remotely through this period. I will remind people as well to regularly check health authority websites for their community exposures as well as school exposures. As we know, this is a bit of a sobering weekend for us. This is the largest number of cases that we've had in a 3-day period, and it is concerning to us that we continue to see growth, particularly in the Lower Mainland and in the Fraser Health region, to be specific. To get through our COVID-19 storm, it requires all of us to do our part. No exceptions, no workarounds, no trying to get around the very few but important rules that we have in place. Every time a friend, a neighbor, or family member tries to put aside the provincial orders, the safety precautions that we've put in place, all of our risk goes up. I'd like to remind everybody about our mass gathering order that is refers across the board to gatherings of no more than 50 people. But there are caveats to this order. It requires that every location must have sufficient space that people can maintain safe physical distancing between everyone. And we know that when these COVID safety plans are followed in settings like restaurants, event spaces, churches, temples, hotels, that we don't see transmission. But too often, over the last few weeks, we've been hearing stories where people are trying to put aside the safety plans, that feel it's okay to have a few additional people, or for people to mix and mingle, and unfortunately, we have seen spread in these environments. Though the majority of places can have smaller group gatherings and do it safely, we also know the vast majority of homes cannot safely accommodate large numbers of people, including 50. So we need to pay more attention to those settings where we have people coming together for celebrations, whether that's weddings, celebrations of life, reveal parties, Thanksgiving. We are now seeing some of the effects of family gatherings that happened on the Thanksgiving weekend. These are important celebrations, but we are in the middle of a pandemic, and we need to take safety precautions to make sure that we're not passing the virus on to people that we care about, people that we're closest to. Similar to what occurred in the summer with vacation homes and rentals, where we were seeing parties that meant that people were inadvertently passing the virus on to many others, we have seen a notable increase in new cases and transmission of COVID-19 as a direct result of social gatherings in private homes. Many of the cases that we've seen in the last few weeks have been related to these important celebrations where people are getting together with larger numbers of people than can be accommodated safely within their homes. I'd like to be clear, this has been the case in every part of the province, but we know the risk is highest where there is more virus circulating in our community, and that has meant that this type of gathering, this type of celebration, has led to more cases in some areas of the province than others. So we do see that the cases and the transmission we're seeing in the Lower Mainland, in Metro Vancouver, and particularly in the Fraser Valley, in the Fraser Health region, have been related to the fact there's more virus circulating in our community, and this type of party is very risky right now. As a result, today I am putting in a new provincial health officer order. This order limits gatherings in private homes to no more than your immediate household plus your safe six additional others. This is to remind us that the rules are in place to protect us, that we need to be cognizant of having that safe space. And if you come from a large family that's living in a home together, 6 additional guests may be too many. And you may need to consider for the coming months to focus on your own immediate family and look at how you can have your social connections with others in a safe way. This is going to be a challenge, more for some people than others. But this is something we need to do together as a community so that we can get through the coming respiratory season and best protect each and every one of our families and our communities. Like all of the other orders, there is the probability and the possibility we have enabled enforcement, but my hope is that we will all pay attention, given what we are seeing in BC right now, and that enforcement won't be needed. That we will do the right thing as we have been doing, because it is about us and those we are closest to. And for a small number of people who may choose to disregard the order, enforcement will be stepped up, and we will be looking at how we can make sure that people do take this seriously. And in particular, we'll be focusing as well on whether there are additional measures we need to take in those areas where there is more transmission of the virus in our community and there may be more risks. So the immediate focus will be on the Fraser Health region because the increase in new cases related to this type of celebration is more notable here. Orders, as we know, are a last resort, but it does reflect how serious we need to take this now. Social gatherings are where we are seeing significant transmission of COVID-19 in BC, and it is not slowing down. When you come together with others, you bring your risks with you, and when you leave, others take their risks home. We've seen that across the province where people have moved to, have gone back home, have gone to attend celebrations or parties and have gone home and brought the virus with them. And this has affected long-term care homes, our hospitals, it's affected schools. And it's affected businesses and workplaces. I know for many people this will be a significant challenge, that large community celebrations are part of their culture and their community. And we must recognize that right now, as we move into winter, we move into the respiratory season, and this virus is present in our community, we are also learning that it transmits more easily in the winter months. So we need to take additional precautions for the coming months. And that means no Halloween parties. That means we need to focus on small outdoor celebrations and memorials for people's funerals, for burials, for November 11th. We need to make those plans now. With COVID in our communities, having large gatherings in our homes is too dangerous. And just as religious leaders throughout the province have so strongly supported our provincial response, I am calling on community leaders to do the same. Help your communities do the right thing as we work to address this global pandemic and its impact on us here in BC. I understand that this restriction is the opposite of many of our cultural, religious, and social expectations. But as we all know, this is not an ordinary year, and this is not forever, but it is what we need to pay attention to for the next few months. Every gathering needs to be with our household and safe six only, and for some large families, even that may be too many. As a host, I ask you not to invite others to your gathering right now, and not to take offense if people back out or don't attend. Show you care by keeping those outside of your immediate household off the invite list for these types of parties. You can have them safely following the safety rules in some venues if they're large enough to host a larger gathering. But what we're seeing now is transmission in households. In addition to this new order, and in light of the increased risks we're seeing right now as we move into respiratory season and influenza season, I'm also stepping up our recommendations and advice around wearing masks. It is now the expectation that people will wear a non-medical mask in public spaces. It's not an order, because this is something that I know we support as part of our mutual responsibilities to protect ourselves and to protect each other. As part of this, I'm asking businesses to review your COVID-19 safety plans with this in mind. If your employees are in high traffic area or amongst many people outside of your household while at work, a mask can help protect you and those around you, and we need to wear them as we are going into this season. Please also ensure that appropriate protocols are placed in lunchrooms and other spots where people will normally gather, because those are also areas where we now see people transmitting this virus to each other. Now is the time for all of us to work together while staying apart, to slow the spread of COVID-19, and together we will get through this winter. The vast majority of people in BC I thank you for doing what you have been doing and sticking with this, even though it is hard and sometimes we are very weary of these restrictions. But thank you for keeping your groups small, for staying apart when you're away from home, for wearing masks, and for using your layers of protection, because this is what will get us through. And this is what will help us as we're going through the next few months. So no matter how this storm evolves, we will continue to do it together and to be kind to each other, to stay calm, and to be safe. Thank you, and I'm happy to take questions.
Thank you, Dr. Henry. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up. I would also ask that you please take your phones off mute. You will not be audible until your name is called. First question today is from Vaughn Palmer, Vancouver Sun.
Good afternoon, Dr. Henry. The day the election was called, you announced we had 8,200 cases. Today there's 5,000 more cases. Why has it taken you so long to announce a crackdown? Is it because the election was underway and you were holding off?
No, I think it's pretty obvious to people that we were doing a number of things through the last few weeks. My focus has been entirely on managing with the team what is going on with this pandemic, and it continues to be. And we have taken additional measures as we've moved through these last few weeks. We did indeed put in extra restrictions. We had flattened our curve, but as you know, prior to Thanksgiving, I made a lot of appeals to people about the need to keep family gatherings small. And unfortunately, there were a number of events that have happened that have led to quite dramatic increases over the past week, as you've seen. And as last week, we talked about the measures that we're stepping up around enforcement and monitoring and proactive inspections in businesses to remind people. And I think we have to remember that we've had a lot of successes. We've been able to open schools. We've been able to open many businesses. We've kept many of our essential businesses going with very few to no cases. But it's hard. It's hard for people to remember every day to check themselves, to think about the risk. And we've seen, like every jurisdiction around us and around the world, that we've seen a resurgence of cases. And we're not immune to that here. And in the last 2 weeks, that resurgence has really focused in some areas of the province and has become at a level where we're stretching our resources to be able to manage contact tracing. And that's why we're adding the additional layers today. I heard from many, many people that they just want to know what the rules are. And people wanted to be able to have large gatherings, and it seemed like it was okay if it was under 50, but that has become clear that it's not okay anymore. And the risk of transmission goes up as we head into the winter season, and it's becoming more and more challenging to determine if somebody has COVID or influenza or RSV or other respiratory viruses we're seeing. So that has been the focus, and that's what we're focusing on now. We need to do this now and into the new year. It's going to be some months before we are through this part of this pandemic here in BC. I am hopeful that we will have things like a vaccine early next year, but it's not going to be for everybody all at once. So we need to do our bit now to focus on our priorities, which is keeping our businesses open as much as possible, keeping our schools open, and keeping our communities safe.
Vaughn, do you have a follow-up?
Yeah, again, to use your numbers, Dr. Henry, it looks to me like almost a 40% increase, 38% increase in the case count in a little over a month. Had you acted sooner, do you think you could have bent the curve before now?
Well, I think we did actually decrease our curve, and now we've seen it increase more in a focal area. So these are things that, we'll see. On the other hand, we talk regularly with my counterparts in each health authority, the people on the ground who are doing the contact tracing. And as I've said all along, we still 80 to 90% of our cases are linked to a known case or cluster. And there are some times where it's gotten out of control for us a little bit, and we looked at that with nightclubs. We looked at that over the summer where there was large vacation parties. And when we put in measures to restrict those and tell people clearly what the rules are, we've been able to bend that curve down. We need to do that now.
Next question is from Joel Ballard, CBC.
Hello, Dr. Henry. You mentioned a crackdown on private gatherings, and we also know that there's more than 50% of the cases of COVID-19 in BC in the Fraser Health region. So I'm wondering, how much consideration did you give to implementing these new restrictions only in the Fraser Health region?
Yeah, we have been thinking about that, and the approach that we've taken in BC is looking at those settings where the risk is greatest. So yes, it's private gatherings, a large proportion of them that have been led to transmission to larger numbers of people have been in the Fraser Health region. And that reflects the fact that more of it is circulating in the community there. But we have seen celebrations of life in the north, for example. We've seen parties associated with transmission in every part of the province. So the setting itself is the same. And I am hearing from people in the community, from business people, that when people follow the rules, things are working fine. But it's this sense that it doesn't apply to me, and that it's okay if we are okay in the church and at the gravesite, but then everybody comes back to my house. And unfortunately, we've seen transmission happen in those events, and people go back to other parts of the province. So what we're trying to address is these are the rules now for all of us around holding events in our house where we don't have that space to keep people safely separated and where we're seeing transmission. In addition, we are looking very carefully at, are there other measures that need to be in place where community virus, spread of the virus is much more apparent, and that is certainly in the Lower Mainland and particularly in the Fraser Valley region and the Fraser Health region. So we will be looking at that, and we have been working with Fraser Health and will continue to look at other things. What we want to do is make sure what we're doing addresses the issue. So we're tackling where we're seeing transmission events taking place. And we're trying to find that balance so that we can keep as much open as possible. And we're not seeing, for example, transmission in restaurants where people are following the safety plans in those restaurants. So we're not looking at closing restaurants right now. What we're looking at is adjusting and titrating to those places where we're seeing transmission happening.
Joel, do you have a follow-up?
Yes, please. You mentioned resources are being stretched, and with more than 5,000 people under active monitoring right now, is there any concern that the public health system won't be able to keep up with the caseload?
Yeah, and we've certainly seen that happen in some other provinces or other places around the world. And particularly to the south of us, where we're also seeing a third resurgence. So that is something we've obviously been working on for some time. Earlier in the summer, we announced a concerted effort to hire people to do the contact tracing, to work with our public health teams, and we've been quite successful in augmenting the public health teams. But yeah, it is right now, with the numbers of cases just in the last week, we're seeing particularly in the Fraser Health region, it is very much a challenge, and we're all been doing this for a number of months now, so it's hard for people. We're all tired. But yes, we are, as a public health service around the province, looking at how we best support those areas of need. So we know there's some challenges in the interior, there's some challenges in the north where they have fewer resources, and of course the focus on Fraser Health. So that is what we're doing. We've hired several hundred new contact tracers, mostly nurses and other health professionals who do this very detailed and important work of connecting with everybody who has COVID-19 and making sure they have what they need. And we'll be continuing to do that. We were working over the weekend to make sure that we could readjust and move resources to support this important work in Fraser Health.
Keith Balger, Global News.
Hi, Dr. Henry. Thanks for this. Are you concerned that people are exploiting the 50-person rule by gathering in numbers, say 40, 30, We discovered an arts fundraiser over the weekend that had 500 people spread out over a number of venues, insisting they were following public health guidelines. But the one venue we saw in a hotel, clearly people were at very close quarters, and they are obeying the 50 number rule. But are you concerned that people are sort of exploiting that by coming in with gatherings and events that take place with large numbers, just not 50?
Yeah, so there was some occasions. I won't say the vast majority of people are doing this right. And we've looked at hotels where they've had appropriate safety plans in place, and people have stuck with them. So those are the things that I mean, we have to say that most people are doing it right, but we're now at the verge where we have seen enough transmission that we need to take action on these areas. And what we're seeing is that, yes, it may be a small group, maybe 30 or 20 or 30 people, but the space may not be big enough to allow people to safely maintain safe distances from those who they are not within a close bubble with. And that's important. Or we see sometimes that people will invite others in because many celebrations, it's cultural or it's usual for people to be able to bring others with them. Right now we can't do that because we see it transmitted and it's challenging to know who is actually there. So there may be events that happen over 2 or 3 days with a different group of 20 or 30 people each time. And that again means that this virus can be transmitted to a much larger group of people, and it may be challenging to find them in a quick way. So those are all things that have led us to take this action today. I will say that every single person is continuing to be followed up, and public health is working at the contact tracing, and we're using the data that we're getting, the understanding of where exposure events are happening to titrate our orders and make sure that we can try and keep this under control.
Keith, do you have a follow-up?
Yes, in terms of enforcement, what would that look like? Are we talking bylaw officers, public health officials? And if you see someone, if you see a bunch of cars outside a private home, for example, should the authorities be contacted by someone who witnesses something like that? That there's obviously a lot of people in the residence?
I think we need to trust people, but yes, the orders are enforceable by bylaw officers, police officers, and environmental health officers. In the same way that we had the orders during the summer at rental properties and places, and I expect that the same processes will be followed. So yes, you can complain if there's a large party, as you would for any noise complaint or other things. But I also know that most people will do the right thing. And it's not that people have intentionally tried to skirt the rules. It's mostly, we get this sense of complacency that it's okay, that the rules say it's this, without thinking that how important it is to make sure that you can make people safe in those environments. And most homes are not large enough to have 50 people or 30 people or 20 people. And now that we're moving into the season where we can't be outside as often as well, we know that risk goes up. So it's, these are important considerations for us moving into the next few months, where there's going to be a lot of temptation, and we need to support each other as communities, leaders in communities, leaders in families, to make it okay to have the small wedding right now with just the immediate family and plan that party for next year when it's safe.
Next question is from Mike Hager, Globe and Mail. Mike, are you there? Okay, moving on.
Sorry, I was on mute.
Go ahead.
Hi, thanks a lot for taking our questions. I just wanted to clarify, just piggybacking on Vaughn's question, is there any role for Cabinet in any of the decisions you made in the past month? Like, was there input needed in any way?
No, I have the ability to issue orders under the Public Health Act as the provincial health officer, so PHO orders come from me. Obviously, we consult regularly with the caretaker minister, so Minister James, the deputy, Don Wright, who's in charge of the government, and also, of course, the deputy minister and myself. So there was no consultations with Cabinet or any of the political side of things, but we do have a regular process to keep the caretaker government informed. and of course ask for advice. We have also had regular meetings with opposition parties on the progression and what's happening and what orders and measures we're putting in place.
Mike, do you have a follow-up?
Yes, great. Thanks for that. I just wanted to further clarify, you were really hoping before Thanksgiving that these private gatherings would be tamped down a bit and the risk mitigated, but it sounds like that was the turning point for you to usher in this new order was Thanksgiving weekend and the new transmissions we're continuing to see from that?
Yeah, so we know that the incubation period is about 14 days and that we start to see cases at day 5 to 7 in particular. And so when we started to see the rise last week, it's very clearly associated when the contact tracers were talking, many of the events that people were attending were over the Thanksgiving weekend. They may have been family gatherings, they may have been celebrations of life, or a number of weddings took place over several days around that weekend. And we're now seeing that. So what we are seeing now is the next level of transmission. So that's why we have to stop this now. And it's not lost on us that there are many more celebrations coming up, not the least of which is Halloween this weekend. And I think, we've said this before, and I have been very clear about this. We need to focus on small groups outside, do things with the kids to help them have a fun time in the small number of things, and that can be done safely. But this is not the time for Halloween parties, for the adults getting together and having indoor parties. That is not what we need, and that cannot happen. And now there's an order in place that restricts that as well.
Lasha Kretzel, News 1130, sorry.
Hi, Dr. Henry. First, in your opinion as an expert, does the outbreak at the school in Kelowna and the closure of that second school in the Fraser Health region, the name I didn't catch, do these indicate to you that the school plan isn't working or whether schools are just not following the plan?
So neither. To me, it indicates that the plan is working, that we're detecting them early. The investigation, we've had just the one outbreak in the province, and the investigation of that's now up to 11 cases. But the investigation shows some challenging and understanding the transmission. So there may have been more than one person in that school who had COVID-19. And so we're investigating that now. We're using kind of some of the new techniques that we have, including using things like whole genome sequencing to understand how transmission happened. But to me, this is the plan working. We know that it's circulating in the community. We know that there's going to be inevitably people who inadvertently are in the school environment. For the most, we put out some of the statistics on this last week. I think there was 216 exposure events and very few transmission events where people passed it to another in the school setting, less than 10, and this was our first outbreak. So to me, that tells us that what we're doing is working and that public health is there and that we're working with the schools and the teams to investigate and make sure we're learning from the exposures that do happen, and in this case, the outbreak.
Do you have a follow-up, Lasha?
Yes. So can you then give some advice to schools and families specifically around things like play dates and masks in schools? So, for example, does this provincial health order then mean that masks should be worn by students and staff at all times while in the learning environment?
Yeah, so in terms of masks, there is provisions for masks in certain areas of the school, and it doesn't change the way the school plans are designed and what they should be doing or how we should be wearing masks in the school setting. I know that young people are adaptable and that many of them are wearing masks on a routine basis, whether they are ordered to or not, and I think that's really important. And we need to continue that and continue the encouragement of that over the coming months. In terms of play dates, I think that's a very good question. I get asked that quite a bit. My kid is in a class with these children, so can they go on play dates? Can I have a birthday party with 20 of the children that are in the class? And the shorter answer to that really is now you need to keep it small. So no, you can't have a birthday party with 20 kids. That's not the time to do this right now, because we know that even though the kids may be in the same cohort or learning group, that the parents are not necessarily. And we know that the parents often will get together and there's a possibility of transmitting. So those are things that we want to step back from right now. We want to focus on the activities that are important for the children in the schools and keeping the schools open and keeping play dates small and outside for the most part.
Next question is from Richard Zisman, Global News.
Hi, Dr. Henry. I just want to follow up a little bit on that around the mask policy. So I'm just trying to understand what you're asking people to do here. Is it all indoor public gatherings where you hope all British Columbians wear masks? And when you talk about the school setting, do you encourage teachers and adults and administrators to always be wearing masks, considering that, sometimes with younger kids that's a bit challenging? Can you be a bit specific on what you're hoping for on the mask? I know it's not an order, but the policy, I guess, you're putting in.
So my expectation around masks as we're going into this respiratory season, and we know that COVID is still with us, is that we will all be wearing masks in public spaces. So if I'm going to the grocery store, if I'm going to the hardware store, the Costco, or on public transit, or need to go into as I had to recently renew my driver's license, those are times when we need to wear masks. And all of us need to pay attention to that now. We know the evidence is showing us that those are situations where we can't always keep our safe distance, and a mask can be an additional layer of protection, both for ourselves and for others. And so that's what we want to focus on for the coming months, getting used to that, recognizing that there are some people who are not able to wear masks, and we need to be accepting of that and ensure that they find times when it's not as crowded, perhaps, and maintain physical distancing. But now's the time to relook at all of our COVID safety plans, whether it's in an office setting, whether it's in a retail setting, and make sure we have provisions in place to protect our staff and to protect staff from each other, because what we are seeing in some workplaces, it's the carpooling, it's the sitting together in a lunchroom or having a coffee together, and we may need to look at how we do that in a certain business. Maybe the room where everybody goes to have lunch is too small, and we need to find additional spaces for people to be able to safely keep their distance during that time in the workplace. And it's a time to revisit all of the plans that we've put in place, making sure there's space between people, making sure we have barriers if we're somebody who is on a reception desk and there's people coming back and forth. That will protect us, will protect our staff so that our businesses can keep running, but also protect customers. In terms of schools, the masking policy that we have in schools, particularly for older students, making sure that we're all wearing masks when we're in the common areas. And yes, we do need to pay attention to staff, teachers, educators who are also either carpooling to work together, having breaks together, having meetings together, making sure that we are wearing masks, that we're keeping safe distances. Now's the time to reinforce those important measures.
Do you have a follow-up, Richard?
I'm just a bit confused still. You say public spaces. Do you mean just public? You mentioned a bunch of spaces. They were all indoors, but they're obviously public outdoor spaces as well. Is the advice just for indoor spaces? And separately, I wanted to ask about with all these new cases, is there any fast tracking for BC to be included on the COVID app? I'm getting a lot of emails about that, and I don't know where we're at in terms of when British Columbia will have access to the federal app.
So no, my mask expectations are for indoor spaces. We do know that the risk still is minimal outdoors. If I'm going to be around a group of people and we're that are not part of my immediate social group or connected group or bubble, then yes, a mask can be an addition. But if I'm outside going for a walk or run and there's lots of space, then there's not a necessity to wear a mask. But the expectation is when we go indoors, we should all be wearing masks. In terms of the app, it's been a challenge for us because there are some parameters that they've built into the federal app that we don't feel work, and we believe would cause more concern and frustration, as we've seen in some other provinces. And so we are still negotiating with the federal government about modifying it to meet the needs so that it would be useful for us. What we really would like to see is an app that we could download when we're at a celebration or a party or a church service, so that we can identify those specific times when there may have been somebody with COVID who was in that vicinity. Right now, it's very non-specific, and it goes back for 14 days, which to us doesn't make a lot of sense, because people are not infectious for 14 days before their test comes back. And I know they've committed to addressing some of those issues, but we've not reached an agreement to address the issues. Certainly people can download it, and if they're traveling, that would be an important thing to do, but it's not at the point where it would be helpful for what we're managing here in BC for our pandemic right now.
Next question is from Lisa Cordasco, CHLY.
Thank you, Dr. Henry. I just want to clarify, because in your statements you had mentioned that these new health orders will likely be in place into the new year. So does this mean basically that Christmas gatherings are out?
Yeah, I think we need to consider all of the celebrations that are coming up, whether it's Diwali or Hanukkah or Christmas, and look at how we can regroup and focus on our immediate families and making sure we can support each other to do it safely. So that is a possibility, that we would not have large family gatherings over Christmas. And we need to focus on our small groups.
Lisa, do you have a follow-up?
Yes. When I look at my own Island Health region, Island Health, there hasn't been a single case of COVID in a care home since this all started. The numbers over the weekend, 0 new cases here. What kind of a challenge do you think it might be to impose these even stricter orders in areas where the transmission rates are so low compared to the Fraser Valley?
Yeah, and we have a lot to be thankful here on Vancouver Island. We know that there have been some exposure events, though, in schools. There has been some transmission, and we know that this virus transfers through people. We bring it with us when we come. The good work that's been done by Vancouver Island Health Authority in making sure we had all the provisions in place that are needed to protect our care homes. And as you say, because we don't have high numbers of circulating virus in the community, we've done an amazing job. They've done an amazing job of protecting long-term care homes here on the island. But it doesn't change the fact that if we have a large gathering and people are coming from other parts of the province, they're bringing risk with them. And so, yes, the fact that we have very low rates here on the island is protective, but it's not absolute. And we need to be aware that having a large party, a large wedding, a large event introduces risk. And the risk is less than what we've been seeing in other places, but it's not zero. And this is to try and address those issues. It doesn't take much for things to take off, as we saw in the summer in Kelowna, for example, and as we saw in the north with a couple of large gatherings where there was transmission to a number of different communities. We've seen it in different parts of the province, and we've seen an outbreak in the north of Vancouver Island. So it's not that we're out of the woods. This virus is circulating all around us, and because people are moving, there is a risk. And so that's what this is trying to address. But of course, the clear and present danger right now is the higher rates of transmission in the Lower Mainland.
We have time for one more question. For everyone listening today, Dr. Henry will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For medical guidance on protecting families and communities, and for access to provincial guidance on COVID-19, visit bccdc.ca. And for information about the province's pandemic supports, visit gov.bc.ca/COVID-19. Last question is from Srushti Gangdev, CKNW. Srushti, are you there?
Yes, hi, can you hear me?
Yep.
Hello? Hi, sorry about that. Just wondering what you, on the topic of weddings again, what you have to say to people who, think they're following the rules. They have maybe 25, 30 guests, but then they have photographers and DJs and caterers and musicians and whoever else they feel is important to make their night special. What do you have to say in terms of guidance on that sort of thing?
And there's been many of those weddings that have gone on perfectly successfully where there's a plan. And there's a plan that keeps people separate, allows them to have the space they need, makes sure that there's not mixing of people from different groups or bubbles, that we have small numbers at the tables, that the servers are wearing masks, all of those things in place. And I know that there's been many successful weddings at different events that have followed a COVID safety plan where it's worked and it's been fine. But what we're seeing is creep. People are getting tired of that. And so or they feel that they want to have larger numbers of people in a smaller venue. And those are the things that we need to pay attention to now. So yes, develop your plan, make sure that you have the right number of people for this physical space that's available. Do it outdoors as much as possible, keep people separated, making sure that we're reducing those risks of transmission. And that can be done safely.
Srushti, do you have a follow-up?
Yeah, do you think that the onus should be somewhat on those businesses to maybe say no or walk away from gigs that they feel aren't being safe?
Well, and I do, and I've heard from many businesses that they've been trying to do that, so I think it's both of us. We need to recognize that these safety plans are there because they work, and they protect both the people who are working at the venue, but also you and your guests and your family. But we both need to take that pact to work with each other. And I hear from some businesses that they have these plans in place and people agree to them, but then a whole bunch of other people show up and they don't feel comfortable, and they get a hard time from their guests. So I'm telling all of us, we're going into a very challenging and difficult few months. We know that because we've watched what's happened around the world. We are doing okay here in BC because of the role that everybody has played. Everybody has done their part. And I know it's challenging to hear this, but we need to buckle down and we need to have respect for each other and continue to do our part and get through this next few months. And that means doing things small and safe.
That's all the time we have for today. Thank you for joining us.
Thank you very much.